अस्सलाम वालेकुम, नमस्ते, सत श्री अकाल। मैं हूं डॉक्टर कामला हैदर और इस वक्त हम शो कर रहे हैं रेडियो फ़ज़ा 97.1 एफएम पे। रेडियो फ़ज़ा 97.1 एफएम जो आपके लिए हर हफ्ते एक नया 24/7 एक नया एंटरटेनमेंट पीस ऑफ एंजॉयमेंट और कम्युनिकेशन लेकर आते हैं। तो आज भी हम एक नई टीम के साथ आपके साथ हाजिर हुए हैं। This is going to be live on Facebook and YouTube, and most part of this conversation will be in English as well. So if you have any problems, if you want us to give you any translations, please type on Facebook live on Facebook, and we will give you the translation of that as well. We will be live on YouTube as well, and again, once again, with Dr. Kamila Haider on Thursday shows on healthy discussions at Radio Faza 97.1 FM. So we have two important guests today, Dr. Arshad Latif and Dr. Andy Foster. They're very busy general practitioners, GPs in Nottingham, and they have been with us for quite a while now. We were trying to streamline this the whole show on Facebook and YouTube, and as you know, this is the world of technology, and there are too many glitches and glitches here and there. We were trying to fix. And thank you to Anu for she's a manager at Radio Faza who has helped out quite a lot, and she has worked hard to get us all to you, to our communicators. Thank you so much. So, without any delay, I would like to disclose the topic of today is men's mental health issues. And this is something that we don't talk about. We talk about children's mental health. We talk about women's mental health. We talk about all categories of people, rich, poor, all ways how people can be affected by mental health issues. However, I have noticed in my practice, 22 years of my practice in psychiatry, that men are very resistant or resilient. They don't want to talk about their mental health for some reason. They just think they're very strong. And sometimes I tell my male patients, it's all right to cry, even if you're a male. It's okay to cry, and that is where they shed their tears and everything comes out. And so we need to understand that men are human beings as well. They're not just robots, and they're not just there to look after the family, to work 24/7 and not to talk about their issues. They probably have more issues than us, but they don't want to come out. um, so we have two experts here, two GPs working in Nottingham, and we'll be specifically picking up on three topics to talk about today, so that we can streamline this whole show of men's mental health. So, first of all, I would like to introduce my guest, Dr. Arshad Latif. Please introduce yourself here.
Assalamu alaikum, and thank you for having me today, Kamla. I'm a GP in inner city practice, and been here on your show before, so thanks for having me.
Thank you, Arshad. We'll go to Andy.
Yeah, hi, I'm Dr. Andy Foster. I'm a GP in Bulwell, so the north bit of Nottingham. Also do a job with what's called the Place-Based Partnership. I'm the Deputy Inequalities Lead there. So, and it's really great to be here and talking about men's mental health and men's issues. Thank you.
Thank you. I was actually asking Andy about the photos and pictures, and some of the artwork that he has behind in this room, and we did talk about it briefly before the show started. So if we have time, we will tell our audience what it is. But let's go towards the questions. So my question would be to you guys is, what is specifically meant by mental health? What is it, and how does it impact our male population?
Oh gosh, which one of us is going to talk first? It's like awkward pause there.
Andy, I'll give it to you. I'll throw it to you.
Yeah, so I mean, because mental health is a really broad sort of spectrum of challenges that people can face, and I think many people are aware of all sorts of mental health these days, because in the general conversation that we have as a population, people are talking more about mental health, but I think men are not talking about as much as other people, and men could talk about mental health more. I guess at one end of the spectrum, you have sort of very sort of traditional, really very highly disruptive sort of types of mental health problems. And in that area, I guess we'd group things like schizophrenia, bipolar affective disorders, very serious. And I don't use that, I use that word in a sort of a clinical sense, really, not implying that what we might call less serious mental health has less impact on people's lives, but that's certainly one end of a spectrum. Other sorts of mental health that people might experience more commonly are things like low mood, anxiety, and these things can have a really, really big impact on people's lives and how they function in their lives, you know, their enjoyment of their lives and how they're able to do their sort of day-to-day activities and duties, you know, work, provide for their family, be there as a partner or a father. So these areas also have a big impact on people's lives. So so keen to kind of dig in and talk about these things.
Yes, absolutely. As I did say that it's hard for men to talk about it. And sometimes, very high profile men, educated men, they do feel very strong that if they talk about it, they feel that as if like they are retreating back or something. There's a weakness, or there is still some kind of stigma attached to it. Will you agree to that? Is there more to that, or it's just a stigma? Is there more issues, Arshad?
So as you rightly mentioned, I mean, my practice as well, I've seen that men compared to women, generally speaking, are more reluctant to speak about it, and perhaps it's got to do a bit to do with your cultural background, upbringing, expectations. Mental health by definition is about your mind, about your feelings, about your emotions. Physical health more so is about the obvious, what you can relate to. So I think, specifically because we're talking about the communities that would normally log on to this radio station, I've seen more so, especially in my inner city GP practice, that men from certain backgrounds are more reluctant. And so, other than the cultural aspect, I feel sometimes men in general just don't feel very comfortable speaking about their emotions. They feel that perhaps you need to be a man, and being a man means you don't talk about those things.
Absolutely. Absolutely, and I do feel, even looking at men, we have fathers, sons, husbands, brothers in the house, and it's just that they are fed that they are culturally they are supposed to be the leaders of the family. They're supposed to be the head of the family. They need to earn. They need to spend their money on the family. And I always tell my children one thing, that for someone to spend money on you, it's very hard. People wouldn't spend money on you unless they really love you. So if a father is spending money on their children, it's their love. They might not show it in the other way, but just by looking after them, looking after their day-to-day life, education, feed them, shelter them, I think that's a very big responsibility that men take on their shoulders. Culturally, they do. I mean, obviously, women work these days as well, a lot of, but culturally, we have seen that men hold that can quite a lot in the
Well,
family.
just on that point, I think men do seek help. So you won't see somebody with a broken bone, for example, just walking around and saying that, okay, I'm absolutely fine, no need to take care of me. But there is that stigma certainly attached to the mental health side of things. So no one will find any shame, asking for help. For example, if they were having heart problems or respiratory problems. But certainly when it comes to your emotions, your mental well-being, then there is that stigma.
Yeah, but actually, broken bone is something very obvious. But what I have noticed is that if they have problems like high blood pressure or, for example, diabetes, which we're going to talk about, they don't really seek help at a very early age. Some people do, but what I have noticed is that they will seek help when some problems visually arise, or they're getting to it's getting to a point where they can't work or they can't function properly, and that is a point where they will think, okay, now I need some help. But when the families are saying, you need to go, you need to ask help from the doctors, go and get your medicine, this and that, I think they delay it to the last moment. This is what my understanding is. When they come, the blood pressure is really high, the blood test, you will see something in there, so things have actually gone to a wrong end when once they arrive. And So this is our understanding, but yes, you see more of the community. Yes, Andy. Yes,
Yeah, I
yes.
was just going to come in and say, because we were talking about men's, I think we were talking about men's kind of likelihood to consult their GP, both with physical and mental health problems. And
Yeah.
there's been various studies over the years looking at general practice data to see how often people do consult their GP, and actually women consult their GP. I think it's about twice as much as men across most age categories. They're more likely to see the doctor when they're boys and when they're very elderly, but generally men will consult a lot less. And people sometimes say, well, that's because women have reproductive or child health issues. Maybe that's where they consult more, but they control for that in the data. And actually, men for physical and mental health problems consult a lot less than women. And also, just interestingly in the data, men live about 4 years less than women on average.
Yes.
So and people argue about why that is, but men should be consulting their doctor more about all sorts of issues. And as you say, addressing problems early, it's a bit like your car, isn't it? If you notice that there's a problem or a rattle, you need to go and get that checked out at the garage, because that can sometimes lead to worse problems that are more difficult to fix down the line. And I think the same principle applies to health. So I just really encourage people, if they think something might not be right, then just go along and have the conversation. We're used to having conversations with people about all sorts of things.
Yeah, and what about the counseling services? How do they run in Arshad? This is for you basically in the South Asian communities. What do you see the response in counseling services for men?
So just like men don't tend to seek help early on. Same goes for counseling as well. I mean, I think in my experience, the people who I refer, and I don't have any stats to back it, but they don't tend to kind of engage much with counseling. They are, and then, I mean, just like you always touched on this before, but I think when we talk about mental health issues, especially things like depression, low mood, and other things, I always say that there's that biopsychosocial model, isn't it? That where you talk about the biological factors, the psychological factors, and also then you try and address issues through medicines where there is a need for medicine. But people generally are receptive towards medicine more than anything else. And when it comes to men, certainly, I think what I felt is that there is that element of hesitation in terms of engaging with counseling, and more specifically so with the communities that I see in my practice, from South Asian background. Again, there is that hesitancy as well to engage. Now, sometimes that could be a language barrier as well, especially for the elderly who might not have English as their first language, or they struggle to articulate their problems. So they feel that, okay, it's not going to really make any difference. Sometimes there are some assumptions about the counseling, that it's more about just somebody giving you a lecture. And what I tell them is that actually it's not. It's actually a two-way traffic, where just like you just come in and you shared your thoughts, your emotions with me, a counselor who's got much more time than I've got as a GP. I only have like 8, 9 minutes, 10 minutes at max. They can listen to all your concerns, and and then take it all in, and then we can all work towards a resolution of certain issues. So that is something that I feel needs more encouragement, because we know very well. And Andy, sorry.
Yes, Andy.
No, I just raised my hand. I was going to come in next, but I was happy for you to finish what you were saying. But I was just going to come in because I had a few things to say about counselling as well, actually. Because I noticed the uptake from counselling is not as good, significantly so. And I think in the first instance, people often don't believe that it will be helpful, and I think that comes from a really not understanding what happens when you go to counselling. So I think it's worth us just talking about that, because we've probably seen it inside the counselling room, but a lot of people haven't. And actually, I've got some understanding for people not believing that it will be helpful when they don't know what it is, or what happens. So that's very logical to me. So I often will explain, what happens in counselling. The other thing is, often men say, "I'm not a talker." If you can get them on board with the idea of counselling, they say, "Actually, I'm not sure I would be very good in counselling. I don't feel that I'm great about talking about my feelings." And I always say, look, this is a professional, that's their problem. You're going to them for them to support and help you, and they'll be experienced getting people talking. And often, actually, that person's talked pretty well to me once they've got going about their problems. So I say, actually, it's no different with the counsellor. Build a little bit of trust, and then talk about your feelings. I also say there's a lot of different approaches in counselling. Sometimes they will talk to you. Sometimes they'll do a lot of listening. Sometimes it's about exploring your past. Sometimes it's about being really, really practical about identifying the current problems and challenges, how you feel and then respond and behave to certain situations, and trying to change that. So there's lots of different approaches, and there's a counselling approach to everybody, for everybody, is what I say. So just go along and give it a go. Sorry, carry on, Arshad.
No, absolutely. Thanks a lot, Dr. Arshad and Dr. Andy, for explaining this. Quite helpful to know this, and I'm sure the men, especially the men who are listening to our show or will see our show later on, maybe they don't have time, they're working right now, busy working, so they might look at it later on and they'll find it very helpful. And even the family members, if they are listening to our show, mothers, sisters, grandmas, I think this is the time when you should have I know we are very kind and courteous towards our daughters and wives, and especially wives. If they say something, the men will be in trouble. So, so, so we have to have a little bit more sympathy towards our men as well. So let's move on to a different topic. Like, we have seen that diabetes as I just mentioned about diabetes, is something we see quite common in our community. And so, Andy, would I ask you to start with you, like just a basic, what is diabetes, what are the symptoms, and then we will go on to how it impacts male population.
Yeah, so I guess at the basic level, and most people know that diabetes is to do with how the body manages sugar. But essentially, diabetes occurs when the body is less able to manage the sugar levels in the bloodstream. And typically, this will mean that blood sugars run higher than they should. So people also have probably heard the word insulin as well. So that's the main hormone, or the way that the body tells its tissues to take sugar out of the bloodstream and into the tissues so that they can be used for energy in the muscles and the brain and the heart and the other areas. So diabetes is where there's a problem with this mechanism. Either there isn't enough insulin being produced, or the tissues aren't responsive to the insulin in the same way, and that means that the blood sugar levels in the blood itself go higher. This can lead to all sorts of problems. If it goes very high, very quickly, then people can become confused, they can lose consciousness, they can be very, very unwell. But for most people, it's a really sort of slow, insidious process where actually a lot of the time people aren't even aware for a long time that they have diabetes, that they have high blood sugar levels. And for those people with diabetes, when their blood sugar isn't well controlled, they won't necessarily feel more unwell than they do at other times. And that's part of why diabetes is really so tricky to manage. But if people run with uncontrolled blood sugars for medium to long periods of time, so that's months to years, sometimes decades for people, it damages all of the tissues of the body. So it will damage your blood vessels, leading to heart disease, heart attacks, those blood vessels in the brain leading to stroke, contributing to dementia risk, can damage the kidneys, can damage the nerves elsewhere. There are just all sorts of problems, at least, and in the extreme, people may have seen members of family or friends who have ultimately needed to have amputations. Certainly I see a lot of patients who don't control their diabetes and need to have toes or even feet or limbs, it's not pleasant to talk about, but amputated because of the damage to the blood vessels and nerves in those areas. So it can be really, really damaging. But the dangerous thing is often you don't know that it's there. And if you do have it, you don't know how badly controlled it is based on how you feel. I don't know if either of you have anything to add to that. You can probably explain it better or in a different way.
So
yeah. Should they be having an annual meeting, an annual checkup or something? Because if they don't know what is happening to them, how would they get it checked?
Really good question, Kamila. And again, just coming into what Andy has already mentioned, there are certain signs to look out for as well. So, just feeling tired all the time, drinking water more than what others do, and you're passing urine more frequently than other times, or what you used to before, could be a sign. And there are other signs as well, because depending on what part of the body, what organ of the body is affected. But these are general symptoms. But also, if you have got a family history of diabetes, then you need to be more cautious. Diabetes UK has got a really good, kind of chart to go by, and if you just type in your details, and ethnicity is a good one there. So people from certain ethnic backgrounds, they have got a higher predisposition. So people from, for example, from South Asian background or Middle East, they tend to have higher incidence compared to other populations. So that, combined with the family history, again, you should be always thinking about. And the question that you raised about screening, people approaching the age of 40, they should seriously consider coming to their GP to have a screening test. That is something that can pick up diabetes early. And then, of course, there are other factors as well, like somebody who has got high weight compared to their height. So what we call as BMI in medical terms, that also predisposes you, or puts you at an increased risk of having diabetes. So if you have got those, and then it's best to be checked really earlier rather than later.
Yes, Sandy, yes.
Yeah, I was just going to add and build on what Arshad's saying. There's the NHS health check. So at age 45, everybody is eligible for an NHS health check at their GP surgery. Depending on how busy the surgery is, they might be sending out letters and they might be sending out text messages to remind people. But even if you don't get one of those, you're eligible. You can have one at age 45. That involves going to the GP surgery and having blood tests done for diabetes, but also for other things like high cholesterol as well, and a kidney checkup. And they'll also do your measurements as well. So Arshad was talking about people who are heavier than we might expect for their height. That can be identified at the NHS health check as well. And we don't get great uptake of this from men compared to women. So I'd really like to encourage any men who are eligible, even if you don't have any concerns about your health, but particularly if you're beginning to have some concerns that things aren't feeling like they used to, aren't running as smoothly, go and have your NHS health check. It's there, use it, and it can identify things early. And that was the other thing I was going to say. Identifying these things early before the damage has occurred is really, really important. And you can even get further ahead of that by thinking about prevention, because people are more at risk of developing diabetes if they are not as active as they should be. So, and we're not just talking about exercise, running and things. Those things are great, but actually just walking to the shops rather than taking the car, just actually being more physically active is really helpful. Being a healthy weight, there's lots of information about there to calculate what your healthy weight should be. Just search for BMI checker on the internet or go to the NHS website to do that. But being a healthy body weight, is good as well. And that's all before you start thinking about the types of food that you eat. Sometimes people focus too much on the types of food and not enough on the actually just being the right weight, because that's actually what makes a bigger difference in terms of prevention. And similarly, being active is really, really preventative as well. So you can get even ahead of that. And the things that you do to prevent diabetes, they're the same things that will help keep you healthy from high blood pressure, from dementia, from strokes, from all of these other things that you might worry about. So it is really, really important.
Actually, when you two were discussing diabetes, I was actually thinking it's not just men. Everybody's going to get some knowledge about it. Like I was, so I need to revert it back that this is something we're discussing about men's population. So again, we cannot emphasize enough that early intervention is important. So everything that can be checked as early as possible is really important. Let's come to some problems that are purely on male population, for example, testicular cancer and prostate problems like prostate cancer. So let's discuss testicular cancer first. So as in your clinics in the community, should I go to Arshad now or Andy? I don't know who's going to take up this. It's a very serious and an important issue about the symptomatology and how to go about with testicular cancers and how you can actually treat them. So a little bit knowledge about our male populations on that one.
Can I start? Because I was going to say, just in general, so testicular cancer is Obviously, it will generally only affect men. The interesting thing about testicular cancer is that I think over half of cases in the UK occur under the age of 35. So this, often people think about cancer as being something that just affects old people, but this is a particular cancer that can affect younger people and actually does to quite a high rate. The absolute numbers of people with testicular cancer in the UK are fairly small, about 2,500 patients per year, I think. So people don't need to get incredibly worried about it, but it can affect younger people. So that's really important to be aware of. And then in terms of what people might find in the early stages, it's basically if one side doesn't feel the same as the other, or so we're talking about things in the scrotum. So we're talking about health, so we have to talk about testicles and balls and scrotums and things. But so testicular cancer, it's an overgrowth of tissue, of cancerous tissue in the testicle. So people might notice that one testicle is bigger than the other. People might notice that there are lumps on the testicle. Sometimes people notice lumps behind the testicle in those kind of veins there, and it's important to get those checked out as well. But testicular cancer tends to be the lumps arising from the testicle itself, and it's really important to address this early. If you address it early, go and see your GP. Your GP will normally examine, but they're used to doing that. They will normally send you for a scan, and then it will normally be dealt with very, very quickly if there's a suspicion of cancer. There used to be I don't know if Arshad, if you can remember this, there used to be a campaign a few years ago called Ball Awareness, and it was sort of based on that concept in football that being aware of where the ball is, it's really important to perform well on the football pitch. And they talked about men being ball aware, so that was examining yourself every week or so in the shower with soapy water when it's warm, so things are easier to feel, and just getting an awareness of what things are like down there, and then if things change, then go to the GP.
As Eddie mentioned, if I could just add on to that, is just like one of the first thing that people would normally come up with is if they've had an injury there, or like you're playing football or something, and then you suddenly realize, oh, something isn't right, which is absolutely fine, and you should really be coming in if you felt that this is not how it should be. But just like for women, we normally recommend that when you're examining your breast, it's best to do it when you're calm, relaxed, taking a shower. Men should be doing it when they're calm and relaxed as well. And the things to look out for specifically is like something which is hard, which is irregular. It doesn't sound right, and especially because you've got two of them, you can always compare the two. If the two are different, it's best to be checked. That's the advice. And as Andy mentioned, actually, it's a cancer of an early age. So in fact, I think some numbers suggest that the majority of them are under the age of 35 when they're first picked up. But the good thing is that not every tumor or growth in that area is very serious. And even if it is a testicular cancer, the good thing about that is that overwhelming majority of them are curable. And if they are picked up early, the chances of complete cure of the disease is really high. The figures are really, really high. So again, one of those cancers that if they are picked up early, then of course it has an effect, and then you can be fully cured of the disease.
And
thank you. Yeah,
I would say one more thing, just to kind of reassure people about some things, because people might think, well, what happens if they think there's a cancer there? I mean, often they will remove the testicle, and people often worry about that. So the first thing to say is the majority of people who come with a lump in their testicle, it's not a cancer, and that doesn't need to happen. But even when that does happen, the body functions completely normally with one testicle. And I've actually had a cousin who had testicular cancer, and I've had a friend who had suspected testicular cancer, had his testicle removed. It wasn't cancerous subsequently, but both of them have gone on to father more children after the event. And the other testicle, it kind of upregulates its production of male hormones, so they're obviously just normal functioning men. So I just thought it was important to say that, because people might not ask these questions, but people worry about the potential effect of having one testicle, and it's fairly minimal.
Yeah, thank you so much. I think I'm just mindful of time now, because we had started late. So I think we quickly touch on prostate cancer now, and that is more commonly seen as compared to testicular cancer. Am I right to say that?
Do you want to lead off, Arshad, or?
And yeah, I'll let you have a go.
That's
I,
fine.
I think we
Yeah.
have two young men who are full of knowledge, and I think this time is not enough for them. We need more time. We need to call them again, maybe with less technical glitches, and to get all the information out of you. I think I just feel that time is so like
Yeah, well,
time.
maybe we can do this again. But
I
yes,
know.
prostate. So testicular cancer is a rarer cancer. Prostate cancer is actually a very common cancer, and it's one of the most common cancers in the UK. I think it's up there with breast and lung cancer. You know, up in the kind of the top 3 or 4 cancers that affect people in the UK. So it is something that people need to be aware of. It is generally a cancer that affects older men, but it's important to start thinking about this beyond the age of sort of 40, 45, 50. I guess people might not know what the prostate is or where it is. So the prostate sits at the very sort of base of the penis, in that area between your anus and the penis, you know, that sort of bit that you spend a lot of time sitting on, or that touches the saddle when you're riding your bike. So it kind of sits inside that area, and it's like a donut. So it sort of sits around the urethra, the pipe that the urine goes through. So it kind of sits around that. So the urethra is like the hole going through the donut, and it's important to know that, because that impacts on some of the symptoms that people get when their prostate is enlarged or becoming cancerous. So like any areas of the body, it changes over time. In men, the prostate tends to get larger anyway. So just to be reassuring, if people are having some of these prostate symptoms, it doesn't necessarily mean, we'll talk about them in a moment, but it doesn't necessarily mean that you've got prostate cancer. Sometimes it's a natural part of being an older man, you know, that you start to have issues with your waterworks. So what effects does it have? Well, like we talked about testicular cancer, you know, cancer normally involves cells overgrowing in an area. So if that happens in the prostate, then the prostate gets bigger both outwards but also inwards. So it can start to press on that tube as it grows inappropriately. Some prostate cancers don't produce symptoms, you know, so we have to be aware of that. So if you're not getting classic symptoms, but you're still worried, it's important to get checked out. But as that tube that the urine goes through is compressed, people get the classic prostate symptoms of having to go to the toilet more often, not being able to empty the bladder completely. Sometimes the force of the urine is less. You know, it used to hit the back of the urinal really with a lot of force, but that's less now. People often getting up in the night to go to the toilet. Men often say, I'm looking for the next public loo when I'm out, you know, shopping, or I'm, you know, driving in my car or doing my job as a lorry or taxi driver. You know, I know where all of the toilets are because I need the toilet a lot. So actually urinary symptoms tend to be those first symptoms that get with prostate cancer. People need to be aware of this all their life really, but certainly above the age of 40, 45, particularly if you've got a family history of prostate cancer, that does particularly increase your risk of getting it yourself. So if you've had a father, brother, uncle with prostate cancer or more than one, then be particularly aware to seek help if you get these symptoms. Might hand over to Arshad to talk about what happens when, I guess, they've identified symptoms and then they come along to the GP. You know, what happens next? Because people often worry about this.
Indeed they do. And the good thing about prostate cancer, as Andy mentioned, is that majority of men will have a large prostate as they grow older. This is part of growing up, and some of them can develop cancer, but more and more studies show that actually people are living longer with prostate cancer actually, and sometimes even when people have got prostate cancer, the doctors would actually decide not to do anything about it because it's not very advanced or anything. So the reason I'm sharing this information is so very vital, that when we talk about cancer, people always think, oh gosh, have I got months to live? That's it. So it's not the case, especially when it comes to prostate cancer. It's very common, but it's not as lethal. But equally, it's very, very important for us to seek advice. So what do we do when someone comes in? There is a test, a blood test that can be easily done. Unfortunately, not the best of tests, because it can sometimes be positive or raising the suspicion of prostate cancer, when you might actually not have prostate cancer, but it's a good start. That's what I would say. So I think it's a good start. The doctor would not just do the prostate test, but also would examine the prostate, which is usually done by examining the back passage and having an idea of how large the prostate gland is. But as Andy was mentioning, the prostate where it sits, it's so really difficult to feel the whole of the prostate. So that these two investigations might not be enough for the doctor to make a final decision whether you have got something serious like a prostate cancer or not. And in those cases where there is a doubt or there is a suspicion, whether it's based on examination findings or whether it's based on the blood test, the doctor might decide to send you for further investigations with regards to the prostate. So that's where all the ultrasound scans and things like taking a small part of your prostate and having a look under microscope comes in. But again, not to scare anybody, not everybody who has got these symptoms has prostate cancer, first of all, but it's important to be checked early. That's the message.
Thank you so much, Arshad. I think yes, Andy.
I was just going to say the digital rectal examination, popping a finger up the back passage to feel the prostate. People often worry about that, but it should always be offered by your GP. But and it's very helpful for assessing you, but you can decline. So don't let that be a barrier for people coming in.
For letting that know, yeah, it's very helpful. Thank you so much. One last question from me is that in both these cancers, do you notice weight loss, and is that a significant thing to notice?
So, oh, sorry, no, go for it, Andy.
I was going to probably.
You have just 1 minute to answer this. Yeah.
Often a late sign of a cancer, including these two cancers. So people should not wait until they think, "Oh, I'm losing weight." Okay. People need to present earlier than that, because it's often a late sign of a cancer. That was the main point I was going to make about that.
Thank you so much, Andy, Dr. Andy Foster and Dr. Arshad Latif. I think they have been very helpful. They've been very informative today. Thank you for your time. I know it's a shame that we should have been longer here, but because we have obviously Dr. Arshad is at work, I think, he said partially at work. So he is at work. So again, Dr. Andy's at work, I'm at work as well. So we have some time to, go back to our work. So anyways, so this show will be on Facebook and YouTube, as I said, and it was very helpful and informative, of course. The main take-home message that I'm taking today is, and I'm sure my audience will, that everything needs to be checked early. So not to wait, not to think that I'm all right. I know someone who is being asked by the family to see the GP. Again, he's made like 3 appointments and yet hasn't attended any of them yet. So it is very important that we all attend our appointments. We make the appointments. The doctors are there to help us. The nurses are there. Healthcare system is there for us. So please look after your health and look after male population. This stands on the female population shoulders as well. Anyway, but thanks. We'll come to the end of the show now. Thank you for the audience for being with us. And if you have any questions, please put it up on Facebook page or YouTube. And we will meet again with Dr. Arshad and Dr. Andy Foster again in another show. And we will be having a show about aesthetics next time. So keep watching us. Keep following Healthy Discussions on Radio Fazat 97.1 FM with Dr. Kamila Haider. Thank you. Allah Hafiz and good afternoon.